Hello everyone, Lisa here with IVF Manifesting a Miracle, and I'm talking with Dr. Greene today of Conceptions. Hey Dr. Greene.
Hey, how's it going, Lisa?
Great, thank you for joining me for a clinical conversation, and today's edition is focused for the fathers, the dads to be out there in honor of Father's Day coming up. So kind of wanted to focus on the male fertility side of things, and I appreciate you joining me for this discussion. I think a lot of people are interested in hearing, about this important factor, that there's a lot of male factor issues that can come up within fertility struggles. And there's a percentage you've shared with us in the past. Can you review that for those who may not know?
Absolutely, yeah. First of all, as you and I have discussed, I take this, as a very personal issue, in the sense that having been through this, I know, for instance, from going through this with my own wife, that as a guy involved in fertility treatment, most guys are sort of plagued with the whole, what can I do to help? Most guys have kind of a problem-solving mentality, and they're kind of raised to identify problems and try to take a very rational approach. And it can be really frustrating to feel like, I'm just kind of on the sideline doing whatever I can to support my partner to it. And I hope the main message that I'd like to convey as we go through a lot of information today is that I want guys to be fully engaged in this process. Yeah. You are a central focus, whether you're officially part of the diagnosis of why you're being treated or not. You are part of the process. Your contribution is vital. And it doesn't start with when the baby's born. It starts before the baby is even conceived. And that's what I think we need to really focus on and draw out today.
I'm so glad you're touching upon this, because I think a lot of guys do feel kind of maybe helpless and not knowing what to do in this process, or a lot falls on the woman, but there's often times where there's male factors that are contributing to challenges. And so I'm really glad that you're encouraging guys to be active in this process.
Well, like I said, we can't do it without them.
It takes two, right?
And the reality is, when you look at the current data, men are contributing to the fertility challenge in 30 to 40% of all couples that are having difficulty conceiving. And what I mean by contributing is that when you really do a proper and a thorough evaluation of any couple, most people, or I should say many, but I would honestly go so far as to say most couples have more than one problem going on. Yeah. It may be primarily one issue, but very often there's a secondary contributing factor. And for instance, we see this whenever someone, assumes that there's a simple or obvious problem, that there's more going on. We see this, for instance, a lot of times when a woman is single, she thinks all she needs is sperm. Then she wants to jump right into using donor sperm. Mm-hmm. We always say, time out. We got to make sure there's not a second or a third or a fourth problem.
Right.
We're talking today is sort of the other side of that coin. Even though a lot of the diagnostic evaluation is focused on women, right, we have to really evaluate the guy. We have to evaluate his contributing factor. And it's not just an all or none situation. It's not like, oh yeah, it's a male factor. It's more like, what? There is a contributing male factor, and sometimes it's very mild, and sometimes it's moderate, and sometimes it's severe.
Yeah, thank you. And one of the questions that someone had sent in to me was kind of, what's the test that you recommend? I mean, is it a semen analysis? It's kind of the first step. What is the first thing you recommend for guys?
Semen analysis is absolutely the first step, but that's exactly what it is as a first step.
Yeah.
A semen analysis is basically our way of looking at one specific specimen at one specific time for one specific guy. And what I mean is, the eggs for women are very deeply hidden inside the pelvis, and we can't observe them or test them in any way. Whereas the sperm, we're able to look at it under the microscope. Mm-hmm. But whenever we look at it, sometimes it reflects something that's going on in the immediate past. And so sometimes, like even if a specimen is abnormal, sometimes that might be a fever that the guy had a week ago, or
Okay.
maybe he put Roundup on the lawn last week and maybe spilled some of the chemicals on his skin.
Oh,
And
wow.
so sometimes even an abnormal semen analysis doesn't say there's a definite male factor, and so we look at the semen analysis and we look at several different parameters.
So it
We
could be
look at
one
their,
sample, it could be multiple samples,
well,
multiple.
exactly. First of all, you start out with one sample, but that one sample, you look at several different things and you
Yeah.
ask basically three primary questions. Are there sufficient numbers of sperm, which
Mm-hmm.
is the sperm count? The second is, are they moving in such a way that you believe they could reach and enter an egg? And that's where the motility and the viscosity are issues.
Okay.
The third question is, do they seem to be of sufficient quality to initiate a healthy pregnancy? All three of these questions are vital. And what makes the semen analysis so tricky is it's only as good as the person that's looking through the microscope at that instant in time, because it's a very time sensitive test. And in some ways, it's a very subjective test. So you really want someone that's fully trained, fully engaged, and I even have to say fully awake, at the
Yeah.
time they're doing the test. And, sometimes, for instance, if someone goes to a random laboratory for a semen analysis, if that person's like running 40 minutes behind and they're in a hurry and maybe they do that test once a month, they're probably not very good at it.
Okay.
So you need to have a trained andrologist, preferably, or someone that's really very dialed into knowing how to do a semen analysis, in order to be able to get an accurate result. Or today, there's also what's called CASA testing, which is an acronym for computer assisted semen analysis. And again, it's not computer only, it's computer assisted. But with a CASA system, even if someone is less trained, that you should be able to get a rough estimation of an effective and efficient semen analysis.
You usually send people out for those, correct? Or do you do them a lot at your clinic?
We do them at our clinic because we hold each person looking through the microscope accountable, and we make them do various testing periodically to show that their accuracy and their efficiency. One of the things I've always found very ironic, Lisa, in testing today,
Mm-hmm.
it doesn't matter if we're talking about someone's pap smear, their EKG, their chest x-ray, it always has the name of the person that's interpreting the results and at least the initials of the person that's doing the data collection.
Mm-hmm.
On every test report you get, the one exception that we seem to find over and over and over again is semen analysis.
Really?
And so when someone's going to a specific hospital lab or a big testing center, it usually has a date and a time stamp on there. And maybe there's somewhere between 5 and 20 workers that day. We don't even know who did the test most of the time. And I find that very bothersome because the test is so subjective and is so subject to interpretation and proper, use of timing, because the motility score suffers over time.
That's good advice. Thank you for sharing that information. What advice can you give for guys to improve some of those factors? You said the number, the movement, and the quality. Are there any suggestions when guys come see you? And
Well, first of all, whenever someone has an abnormal test, depending on how abnormal it was, it's always important to see, was it computer assisted? Was it done by an andrologist at a fertility center? Or was it randomly done? There's even home collection kits that are available today. And there's even certain apps people can get for their phone to do a basic semen analysis.
Really?
So there's ways that people can get a rough estimate, from some of these things. But one test is not definitive, even when it's done perfectly, but especially when it's done with one of these shortcutted systems.
Yeah.
So if one is done abnormally, you definitely want to do at least or at least offer someone a repeat done properly and efficiently, by a system that is trustworthy and reliable and subject to evaluation.
What about insurance? Is that covered typically for this test? Like,
It's so variable. It's variable from state to state, and it's variable from one policy to another.
okay.
And
I
you
can't
have
even
some
remember what that
yeah,
costs.
you have some comprehensive policies that cover everything, and some that cover nothing, or some that cover testing only, which includes semen analysis, but then they won't cover any treatment beyond the testing. So it's highly variable.
Okay. So get it done by a specialist and have the readings done. So you kind of take a look
Or
at
at
the
least,
readings.
or at least don't freak out if you have it done, by a non-specialist and it's
Yeah.
abnormal. Because I have seen situations where guys just kind of shut down, and they get a test and they're a little upset, or their ego feels a little
Yeah.
bruised, and they're like, I don't want to do this. And I'm like, no, no, no. That's just a warning call that you need to do something and do it maybe more efficiently and more carefully to get a better investigation.
Okay. So sometimes you recommend to guys to have it done again, or
Yeah. And in fact, we don't, it's not just us, but officially, it's not considered that there's a contributing male factor unless you have at least 2 abnormal specimens done at least 6 weeks apart.
Okay. Okay.
And that's what I mean when I said that it's one point and one time.
Okay.
Because if a guy has a bad semen analysis this week and has a significantly better one, 6 or 8 weeks from now, well, keep in mind when we're doing a diagnosis of fertility, people aren't trying 1 month. They're trying over a course of several months. And just like women might not ovulate every month, they could have a month or 2 where they're not ovulating.
Yeah.
Guys can have fluctuations in their sperm count. Sometimes it can vary seasonally, and I've seen this in my own practice in guys, for instance, in certain occupations where it can vary dramatically. It can also vary because if a guy, for instance, recently had a fever of 102, 103 that was elevated for many days, it could take weeks for his sperm to recover, but it often will recover.
That's good
So there's
advice.
all sorts of things that need to be considered. And just like when you're considering fertility in general, you got to consider the timeline.
And 6 weeks is about the time between those 2 tests for guys?
6 weeks minimum.
Minimum.
Yeah,
Okay.
because again, and what that's about is the fact that, it takes sperm about 90 days to mature. But it's really the last 6 weeks or so that's most critically related to what's going on metabolically in a guy's system and whatnot.
That's great. That's great advice and information. A question that just came into my head about, women know about egg freezing, or at least I would hope that more women can know about this at a younger age. What about saving sperm? Like, is there any
Absolutely, and it's
data?
something that's become a routine part of practice. For instance, we deal with a lot of military people that are on deployment, and sometimes they can't be available. We deal with a lot of firemen that sometimes can't leave a firehouse at the time when their partner might need to be. And we deal with a lot of seasonal employees as well. One of the things I've found, for instance, having lived in the West Coast and now, obviously in the Rockies, is that, for instance, people that fight brush fires, they often can have a pretty significant variation, not only in their availability, to their partner, because sometimes they get deployed very suddenly with very short notice, but sometimes some of the flame retardants that they're exposed to when they're out fighting brush fires in particular can sometimes impact sperm count and quality.
Wow. There's a lot of lifestyle factors.
Well, exactly.
Job, your profession,
so I've literally had firefighters that'll freeze, specimens in the winter so that if they do have a drop in their quality in the summer, that we're less concerned about. I've seen similar things with farmers. I fully support and encourage organic farming.
Yeah.
But for instance, people that are farming and are exposed to various pesticides and herbicides can very much impact sperm count. Keep in mind, these are chemicals that are designed to prevent other species from reproducing. It's kind of naive to assume that they can't affect sperm quality. And so sometimes if people have to apply certain chemicals, it's worthwhile to freeze specimens, during the season when they're not using those things. or better yet, consider organic alternatives.
Yeah, no, these are wonderful. I think there's so much talk about with women and the chemicals you put on your face with makeup and even cleaning products. And I'm sure there's so many male products that are out there that are not recommended or should be.
It's not even just male products, Lisa. One of the things I explain to every male that I talk to, again, being a guy myself, I can relate. And guys tend to be real casual about chemicals that they're exposed to.
Yeah.
You know, I've seen guys like spill gasoline on themselves and just laugh about it, or walk through a crowd of people, you know, smoking cigars and just take a big deep breath. Now, the reality is I tell each man that I meet with, think about the things that you're not going to want to expose your infant child to.
Yeah.
Because we all appreciate babies are very sensitive to things like smoke or fumes or things like that. I tell them sperm is even more sensitive than a newborn infant.
That's amazing.
Because if the sperm gets damaged, you don't get that infant.
Oh,
And
yeah.
it gives a different perspective.
Right? If you want
It gives people a different perspective that,
oh.
you know, and it also, it gives very practical and very real advice, you know, because, you know, if a guy says, well, you know, I paint things all the time and I don't wear the recommended respirator. I'm like, would you, you know, airbrush that same car that you're painting with your infant child sitting by your side?
Wow.
And if they say, of course not, I'm like, then you put on that respirator and you make sure you wear it.
Yeah, no kidding. Do you have any numbers or data to show with the drinking or the smoking or anything like that that contributes to poor sperm quality, or numbers?
Well, and the problem with, you know, a specific question like data like that, Lisa, is that we're always looking at lifestyle, and
Yeah.
humans are very difficult to
Yeah.
observe, especially over long periods of time. And so, and even when you can observe, there's often a collection of things that are going on simultaneously.
Yeah.
You know, I'll give you an example from women's health. There were some studies in the 1990s that suggested that coffee and caffeine were really bad for women. And hindsight, looking back, a lot of those studies were performed on people that were hanging out a lot in coffee houses where there was a lot of indoor smoke. And we understand today that nicotine and caffeine really exacerbate each other's effects.
Yeah.
And if you fast forward to today, newer studies, you know, related to coffee and caffeine today show that coffee and tea actually have health benefits and might actually improve some people's reproductive, you know, outcome when used in moderation.
Yeah.
But the reality is
Too many factors to
exactly. And so, you know,
yeah.
the problem is when we talk about these lifestyle related things, you have to try to dissect it out, and it's much more nuanced than we would like to see. So it's hard to say this definitely affects that by this much percentage.
I think the two things that I remember hearing about with lifestyle for guys were like kind of avoid hot tubs and avoid tight fitting briefs. Are those?
Yeah, and even that is a very popular myth that's been dispelled.
Okay.
You know, a lot of those ideas came from theories, and over time those theories were able to be tested. We know that prolonged fever can affect sperm.
Okay.
And that's where the idea of hot tubs came along. The idea of tight shorts and cycling came along from looking at studies that were performed on cyclists, professional cyclists in the 1990s.
Okay.
Today, we understand a lot of those cyclists were doing things that were to try to enhance their performance, including using certain steroids.
Oh, geez.
Illegally, to try to boost their performance in their particular event. And we're realizing today that some of those studies were tainted by the steroids they were using, that they weren't even admitting. They were actually trying to hide they were using those things.
Oh my gosh.
And so things were blamed on the shorts. Now, I'll tell you a fascinating and very involved study that was done, and I actually outlined this on my blog. There was a study that was performed about 3 years ago and published in, I believe, the journal Andrology, which is a male fertility journal, where they took a group of men, two groups of men. One group was living in Texas. One group was living in Minnesota, okay? Two different climates.
Yeah.
And half of the men were wearing boxer shorts and half of the men were wearing briefs in each location. And they also studied both locations in both the summer and the winter, okay? Because again, it gets really hot in the summer in Texas and gets really cold in the winter in Minnesota.
Yeah.
And they actually had these men wearing a device that they were able to monitor what the temperature was in the area of where their sperm was being produced, for lack of indelicacy.
Okay.
And they found there was no impact on boxers versus briefs or living in Texas versus living in Minnesota.
Okay. Well,
but it took a very detailed study to really dispel this myth that started based on a theory in the 1990s. So, you know, the whole boxers versus briefs, there's really no data to support it. There was a theory that now there's data that actually says that theory wasn't very valid.
That's good news. And
it is for guys. You have more freedom on what you want to choose.
Yeah, personal preference. What about supplements?
Yeah, supplements are a great idea, but we also have to go back to what we're trying to do. The idea of supplements is that if guys are having problems, let's give them some of the vitamins that we know are critical for sperm production. But I always remind people, Lisa, the reason we call supplements supplements is they're intended to fill in the gaps of an unhealthy diet. And what we're learning today is if we instead maybe improve the diet, we can often get a much better effect than saying, hey, keep living with that bad diet and here, try to take this supplement to fix it. And so there's newer studies that have come out over the last couple of years showing that, for instance, if guys adopt more of a Mediterranean diet, you know, which does not have to be vegetarian, but it's sort of not the paleo, you know, eat all the meat you can consume kind of diet, you get much better improvements than if you try to stick with a bad diet and take a supplement. And so again, dietary and lifestyle recommendations seem to be far more efficient and effective than actually just trying to fix a problem by taking a pill, but yet ignoring the problem that caused it to begin with.
Yeah, so Mediterranean diet, I like that. That's good information. Do you, as a clinic, do you ever send people out to, say, a nutritionist, or do you just kind of talk about it in your sessions with guys if it comes up, or how do you approach them?
Well, again, I can't speak for everybody. You know, our group, for instance, we've got 4, soon to be 5 physicians. We all do things a little different. We all have different communication styles. And honestly, I'm not in the room with them. Myself, I definitely engage. But as a clinician, Lisa, I not only talk, I also listen.
Yeah.
So I don't try to force things on people that don't want to hear it, you know? And if someone is not open to any suggestions, I'm not going to be out there, because then that comes across as they think I'm judging them or lecturing them. I don't do that.
No, that's why
on the flip side, on the flip side, when I have a receptive, you know, a listener, I'll give them not only advice and guidance, I'll give them data to support it. If they're willing or want to take it to another level, I'll definitely do everything I can to do it. But what I'm always worried about is I don't want to come across as being so overbearing that they're just going to shut down and not engage at all. No, you know, it gets back to what you said before. It's like taking a step. And if that step is successful, then we take another step and then another step.
No, that's wonderful. That's a great approach you have as far as really listening and how do people want to grow their family, what their dream family looks like, and guiding people that way.
It's all planning families. I tell people all the time, I think it's so ironic that the term family planning is a euphemism for contraception, when in reality, what we do is we plan families. I always like to start by asking people, not do you want to get pregnant, because that's the reason they're there to see me. It's like, how many children do you want to have?
Mm-hmm. Yeah.
Let's talk about that, because if you want to have more than one child, we need a short-term plan and a long-term plan. And there's even new information, for instance, that just like, women that have various health problems sometimes have problems with their egg quality and their fertility. There's emerging data that if a guy has problems with his sperm, sometimes that might be indicative of other health problems. Or to put it another way, we're talking about male health today. So I hope you don't mind if I go just a little bit off subject, but it is relevant. Guys that have erectile dysfunction, okay,
Mm-hmm.
which obviously is involved in reproduction.
Yeah.
But a lot of guys say they want to fix that problem with a pill like
Yeah.
Viagra or
Yeah.
Cialis or whatnot.
Right.
Any guy that has erectile dysfunction should be evaluated by a cardiologist, because the small vessels that help a guy have an erection are very similar to the small vessels in the heart. And it's been shown that if you try to ignore the problem of heart disease and just give a guy a pill for erectile dysfunction,
Mm-hmm.
he might not only be able to perform sex, but he might have a higher risk of having a heart attack or premature death. And so again, this is all related. Health and reproduction are intimately linked. And a lot of guys don't go in for routine health checks. And so sometimes an abnormal semen analysis is a good reason to say, hey, you know what? Maybe it is a good idea to also get your cholesterol checked and make sure you don't have some other underlying health challenges, because your partner doesn't just want you there to initiate the pregnancy. She wants you to be there to raise that child as well.
To live, to be there. No, that's wonderful advice, because you don't think about how sperm quality, motility, the shape, all those factors.
I think about it. I think about it every day.
You don't think about how the heart, how the our cardiovascular system, how it's all connected. Like, you don't
exactly. It is all connected.
Thank you for sharing that. And then another question that came in was about the benefits of ICSI, and you can explain what ICSI stands for, but how male factor components or factors can be, helped with ICSI.
Well, ICSI is an acronym for intracytoplasmic sperm injection. Now, the simple definition: one sperm, one egg, putting the sperm inside, okay? So in other words, let's go back to just basic reproduction for just a moment for comparison. Statistics show, and you can go to the American Society for Reproductive Medicine's website for this, a 25-year-old woman trying to conceive on 1 month with a very fertile male of a comparable age, if they try for 1 month, their chance of successfully initiating a pregnancy is about 25%. You can remember 25 at 25. Now, the reason for that, not every egg's a good egg. Yeah. And statistically, in young women, 1 out of every, 2 to 5 eggs is a good egg if she's a very fertile woman. Now, when you think about the fact that in fertile men, when you look at the sperm quality, theoretically, for most guys, somewhere between 4 and 10% of sperm are good sperm. So the reality is, when people are trying for 1 month, you've got about a 2 to 5% chance of having a good egg and a 4 to 10% chance of having a good sperm. Then they have to meet at the right place at the right time and have all the other things go right to support implantation.
Totally.
Once you realize that, you could understand our perspective is that when a woman works very hard to do an IVF cycle, because ICSI is part of IVF.
Yeah.
She's worked really hard to produce every single egg that we have. Whether she has 4 eggs or whether she has 40 eggs, she worked hard to produce those eggs. I don't want to risk a bad sperm ruining one of those good eggs. And so if even in the most fertile guy, 4 to 10% of those sperm are good sperm, do you really want to roll the dice with 1 out of 10?
Yeah.
You could see that, and not only that, a second important reason why I think ICSI makes sense, when you do have an egg, if that egg doesn't fertilize, why didn't it fertilize? Was the shell too hard for the sperm to get in, or was the sperm too weak to get through?
Mm-hmm.
Or is it even really relevant? Do you really care, or would you rather just optimize the chance that that egg has of succeeding? So
Mm-hmm.
what ICSI does is it bypasses these issues, and it says, you know what, I'm not going to risk a bad sperm getting inside and ruining the egg that way, or I'm not going to risk a weak sperm not being able to get through, or I'm not going to risk the fact that it's a strong sperm, but the shell of the egg is too hard for the sperm to penetrate.
Mm-hmm.
Let's not worry about what's happening in the body. Let's instead give each egg the best possible chance. And that's why one sperm, one egg, and
Yeah.
very carefully have a very highly trained embryologist inject one sperm inside each egg. And that's why I recommend ICSI.
And I love that you're explaining this, because I think the semen analysis, that first step, gives you such information. And after, like in our situation, they said IVF is really the route for you to go. IUI was not, not maybe good swimmers, maybe not enough, couldn't penetrate an egg or whatever. So many people I know try IUI first, and it can be.
Or let me even put it to you a different way, because I've heard, I've been doing this 25 years,
Yeah.
people will pose the question isn't it more natural to let the sperm penetrate the egg naturally? And I always say, first of all, there's nothing natural about IVF, okay? IVF is you're trying to improve upon the limitations of what happens naturally.
Right.
But let's talk about what happens naturally. In a natural cycle, in a very fertile couple,
Yep.
the man deposits approximately, on average, somewhere between 20 and 80 million sperm at the opening of the cervix.
Okay.
Okay? Now, in that natural cycle, it's estimated that somewhere between 200 and 300 sperm make it through the cervix, through the uterus, through the fallopian tube, to where the egg is actually being released, which is where fertilization takes place naturally. So in the natural cycle, you're winnowing down from somewhere between 20 and 100 million to somewhere around 200 to 300 sperm.
Wow.
And
Wow.
so basically, you're letting that natural process ideally select, number one.
Yeah.
Number two, it's important there aren't too many sperm competing for that egg, or it's too easy for more than one sperm to get in and ruin the egg that way. Now, when people perform what's often referred to as conventional IVF, what they do is they try to reduce the chances of that by putting about 50,000 sperm that have been washed and isolated in the vicinity of the egg, but still 50,000 compared to 200 or 300 that nature has selected. You could see that what happens in a conventional IVF cycle is not near to what happens in nature.
Right.
And so if you're going to go to the challenges of using IVF because you embrace the science of what the technology is able to, why would you want to skip the one step that then gives each egg the best possible chance?
Yeah.
What's natural is a romantic idea, but science is what we can validate and test and reproduce and do better sometimes than what would otherwise happen naturally.
Yeah, no, wow. You just are a wealth of knowledge. Thank you so much. I think this has been really valuable for a lot of people. But ICSI, like you said, is part of IVF, and it's really as specific as you can get, right? To give yourself the best chance. I mean,
exactly.
selecting one sperm.
And then again, not every center does IVF the same way. What we recommend, since we focus on live birth rates, we recommend taking each step that the technology offers so that your primary goal of having a healthy live-born baby is reached.
Yeah.
Okay? But the secondary goal is, if the process breaks down at any step along the way, to try to learn what you could learn so that you're not just doing the same thing over and over again, or just wondering why it didn't work. And again, when you use the technology that's available, then you can not only optimize your success rate, but also optimize your knowledge of what's going on and what you could do to further improve things. And the technology is not perfect. And that's why, success rates are nowhere near, perfection. But that's my motivation, is to keep figuring out the next breakthrough we can identify to keep pushing the rates closer and closer to 100%.
Thank you. Well, I applaud you for all you do for so many individuals and couples, and helping us achieve our dream of having a healthy baby.
Hey, it's an honor, it's a privilege, and it's also incredibly interesting and exciting.
Yeah. And so hopefully for the people listening, for the guys, this was really valuable, and for their partners and wives, girlfriends, spouses, all of them, this is really valuable. It's not talked about enough, I don't think. So
Well, and happy future Father's Day to anyone
yes,
that's
to
listening.
all the dads to be. And just want to let everybody know, if you're looking for support on this emotional roller coaster, IVF, if you're in it right now, I've been there, and I offer coaching support and looking to do not only individual, but also more group support too. I think there's definitely value in
And if I could comment on that,
yeah.
I could speak to that personally. I could take off my professional hat, although I have
Yeah.
hat hair right now. That I would have to say, when I was going through this process with my own wife, it can feel very isolating for the guy. And, you and I have talked about this, Lisa, and
Yeah.
I fully applaud what you're doing and trying to achieve, because I think more men need an outlet of someone they can discuss some of their concerns and feelings and frustrations with. Someone that's not a clinician like me, but
Yeah.
people that have been through the process and can kind of speak from the heart and say, here, I kind of know how that feels, and here was the way I processed that. And
Yeah.
I really hope that more people reach out and embrace that opportunity.
Thank you. Yeah, I've already been drawing my husband in and approaching him, and he says, if I can help other guys through this, I'm all on board. So I'm like,
Excellent.
and I just wanted to hold this up. So I just want to thank you again for writing the foreword of my book and the paperback. I'm hoping to release it, honestly, like tomorrow, hopefully. I'm crossing my fingers it's going to be ready on Amazon, but the Kindle version's up. And thank you again for writing the foreword. Hold on, baby. So reach out to me at ivfmanifestingamiracle.com, and you have a blog, which is enhancingfertility.com.
Mm-hmm.
So we're here for you, and message us. Thank you again, Dr. Greene. You're wonderful.
Have a fantastic day.
Yep. Happy Father's Day. Bye.